Now, there are fears that a cholera outbreak could worsen for people hit by the floods in Malawi. Thousands were displaced following Cyclone Freddy. There are also concerns that those living in temporary shelters are more at risk. Joining us is Sherifa from Gift of the Givers, Malawi. A very good afternoon to you. Thank you so much for your time. Cyclone Freddy has indeed left a trail of destruction. In the process of trying to assist, what have you encountered?
Thank you for having me. Good afternoon. Yes, we have encountered quite a number of challenges, and as you say, cholera is a threat because the camps where people are living are congested. There isn't enough sanitation facilities. They don't have enough water. In some areas, they don't even have clean water because the sources of water have been damaged. So it's a real threat, and as Gift of the Givers, we are working closely with the health department to make sure that these people are provided with the items that they need to prevent. So with our food items that we've been sending out last week, and even we continue this week, we are adding in water purification chemicals so that at least they can purify their water, as well as some hygiene pads, water and soap, as well as a bucket that they can use to carry water for washing, and also a bucket that they can use to clean their water for drinking. So we are working closely with the authorities to make sure that this does not happen. But it's a real threat, and even the authorities are trying their best to make sure that this doesn't happen.
The storm is said to have dumped the equivalent of 6 months of rain in just 6 days. That in itself is a really frightening picture. Talk to us about some of the other challenges, especially looking at the cholera outbreak and what that may mean if it spreads.
So, as you said, we had 6 months rain in 6 days, and that caused a lot of mudslides. So, in a lot of districts, there's mudslides. Tomorrow, we are going to a district in Cholo, the Cholo district in an area called Makwasa, and we are told that that area also is cut off. We've tried to get a land cruiser that we can at least reach the people. So, it's a matter of also a lot of people are still not yet reached. They don't have food, so even hygiene is like the last resort for them. Currently, they're hungry, they want food. So the danger is real there. We have also organized tomorrow to airlift some of the aid. We are sending some aid to a cut-off village in Chipawa district through Department of Disaster Response. They've allocated a helicopter for us to airlift that aid. So you can see there's still a lot of pockets of people that have been cut off. They haven't had food for a week. They're eating whatever they can salvage in their community. One of them, they were saying that, their maize has been washed away, but it was almost at the harvest level. So they're going into those fields that have been damaged, picking the maize that is on the floor and trying to eat that. So there's still a great need in terms of reaching out to people, providing them with the food items, but also looking at the hygiene issue. Today I was talking with some partners. They're designing temporary toilets. So that's also something that's missing in the camps. There's not enough toilets. So we're looking at, okay, how can we partner with them so that they have enough toilets in the camps that the people are living in? They have water. They have chemicals that they can use to purify the water, because the water might not be pure for them to drink, because of the cyclone, the way it has damaged everything.
And what about, the other challenges, people in remote areas, the challenges of getting to them, which, of course, in itself increases the chances of the death toll rising?
Yes, that's true. A lot of areas are still not accessible, but we have a lot of organizations. We have WFP working closely with the Department of Disaster to airlift aid to those communities that have been cut off. And today I was chatting with the DOTMA, the one that's coordinating the whole response in terms of airlifting aid, and just to check with them which areas are still remaining. So thankfully they've reached quite a lot of the areas. Tomorrow we're going to one of the areas that hasn't been reached yet. And also we have people coming in to offer the land cruise I'm talking about. Is being offered by one of our suppliers, Farm Inputs. He said, I have my land cruiser, we can use it. to reach out to people. So we are trying, whatever means we have, to reach out to people, provide food, provide hygiene packs, so that at least we try as much as possible to prevent the cholera. I was speaking to an environmental health officer for Blantyre district this afternoon, just to see where things are in terms of the fear for cholera. So thankfully, we haven't had cases in the camps. In Blantyre, there's been one reported case in one of the camps. So at the moment, we are thankful. We thank God that there hasn't been an outbreak yet, and we are hoping that that stays like that. We don't get outbreaks in the camps, because that would be another disaster.
Absolutely. Thank you so much. Wishing you all the best there.